When I started with this, what might be seen as a dual career, it did feel like law and medicine were not well integrated, that there are two different worlds that occasionally would collide. My area of interest in medicine, my medical specialty, is occupational and environmental medicine. It is basically studying the impact of environments, especially workplaces, on health. The COVID pandemic came as a surprise to us all. By mid-March, we were seeing in Massachusetts basically an incredible rise in infection rates among our workers. So the first thing that we did towards the end of March was to mask all hospital workers on a daily basis. And it was a very dramatic, immediate drop-off with that masking. 2 weeks later, we masked all patients coming into the hospital. And when we mapped out the data, what we saw was a further decrease in hospital infections to the point of our infection rate among hospital workers was less the infection rates in the communities. At the publication of our article in May, the CDC made the determination we're going to be going forward, and they used our research, as the basis for going forward with that and announcing to the public we should all mask. Shortly after our research was published, I got a call from a New York publisher indicating that they were very interested if I could write a book. So I said yes, thinking that this is something that would be a public service. This was a way to spread the public health message about the importance of masking. It looks at the underlying science and data behind the pandemic, and it urges everyone to consider practical ways to better manage the pandemic so we can normalize our lives. It's sort of a how-to book in that it poses sort of a number of questions that people frequently ask. All these sorts of practical questions, which quite honestly, I had to answer hundreds of times. And so I had a pretty good idea as to what was worrying people. And so this book basically captures that. It captures that practical advice as well as this research information. So my role here at Boston College Law School is to be a professor. During the pandemic, I found myself in an unusual position in terms of having expertise and experiences from my hospital work that was directly relevant, to everyone working here at Boston College. The law school dean had put me on a university committee. It was called the COVID Pandemic Working Group. So everyone was concerned about the pandemic. So suddenly, this other life that felt at times so segregated from the law school became important to everyone, and I learned, the importance of providing information, in an objective way.